Hey guys, I'm joined here with Reagan from ALTUS, who's going to be joining us here on the Brooks Report Live. My name is Adam Brooks. Hey, we have something special coming up for you guys. It's called DocTalk. It's going to be happening here on the Brooks Report Live occasionally. Reagan, tell us what we have coming up.
Adam, thanks for having us, guys. We're so excited. Like Adam said, be sure you like, subscribe, and share so you guys can stay informed and up to date. We're going to be doing all kinds of good, relevant topics that you guys in the community are asking about. And the great thing about this, Adam, is it's a live Q&A with a real doctor. You guys can hop on live time, ask your question to a real doctor. We're going to be talking about important topics like, COVID, what's going on in the current health system right now in the world. So many things that you guys want to know that you're asking about. We're going to talk about it right here, So thank you, Adam.
Yes, sir. Hey, listen, I want to say this is just another one of those things that ALTUS does for our community to bring us. And so we thank you guys. Listen, put a 1 in the comments if you're watching this live. Go ahead and do that now, and put a 2 if you're watching the recorded version. And don't forget to share this stream. Tag some folks that maybe had some questions you've seen posted on some groups, and, well, they can ask a real doc right here. So thank you, Reagan, for doing this on the Brooks Report Live. We appreciate it. Thank you, guys. Now enjoy.
Hey, Adam, thanks. We love you guys. We love our community. And this is just one more way ALTUS can give back to you guys. Here we go, guys. Enjoy the show. What's up, Dr. Goffi? How are you, man?
Hello. Welcome, everybody.
Hey, live from Baytown. Dr. Goffi's at home today. It looks like you're off enjoying this day.
Well,
so, hey.
It's been a little rainy, so hopefully
I know.
It's get better. We can also get outside.
Finally getting some sun after all that. But, hey, in case you guys didn't know, Dr. Goffi was recorded the other day. I guess was it CBS? They did a report with you?
Sunday morning show. Yeah, we talked about misinformation of COVID, a lot of the stuff that we covered here. It was pretty exciting.
Awesome.
Like national television. We'll see how it goes. They don't tell you the edit, so hopefully I don't look bad.
So you guys better get in line to go ahead and get his autograph, because he's probably about to go viral and be famous. What date is that going to air so all the viewers can watch it and check it out?
Sounds good.
Is it going to be this Sunday? You said it'll be airing?
Sunday the 3rd. Yeah. So I guess it's 9 a.m. Eastern, I think, till 10:30. So it's going to be 8 o'clock to 9:30 our time, CBS morning. The show's about an hour and a half, but they do like a little 4 to 5 minute little segment. We showed them around the Baytown, got an inside look on what it would be, what it's like with COVID when you get the serious consequences, wearing that mask and breathing like that. So
be sure to check him out, guys. October 3rd, this weekend, get to see him for maybe an hour. That'll be really cool here at our Baytown location. But anyway, guys, we wanted to do something different today. We wanted to talk about, sport injuries. We got a lot of people playing sports right now, a lot of kids playing sports right now. So I've been getting lots of different questions about sports injuries, Doc. So to start us off, the first question I got, does ALTUS have any different equipment to determine fractures, sprains, concussions? Tell them about all the equipment we have, Doc.
Yeah, I think this topic is very important, especially now that football is back, right? It's been back for a little while, and there's a lot of things that unfortunately we're not great at, right? We're not great at making sure our kids are hydrated, and of course injuries, right? So a lot of injuries can be, every foot doesn't always go a different direction in a fracture, right? So they can have some pain, some discomfort, especially with being tackle football, right? Or any sport in general, you can have an injury. ALTUS has all availability except for an MRI. So everything that is acute, we have our X-ray, we have our CT machine, we have everything that we could possibly need. Plus, we have the physician that can also evaluate, see if it's necessary to have that type of imaging. MRI is something that's usually reserved for 2 to 3 weeks after an injury. It's not really considered something acute because everything that you would need, we would have at ALTUS.
Okay. So what's the most common injury you see from football and different things like that? Is it fractures, breaks? I guess, are those the most common?
Concussions is one. And then, of course, some sort of break, whether it's a rib injury or wrist injury or arms, and of course we see ACL tears, which is very, something that you might need an MRI, but acutely we can make sure that there's no fracture associated with it, which can happen, of course, with those types of tears.
Got you. So how common is injuries in sports? Is it a lot more common than people think from playing all these sports?
It is. I mean, and in a lot of things, that's one of the biggest things about being evaluated, right? I mean, you don't always completely tear, a tendon. So off a good physical exam, we can say, hey, this tendon looks like it's pretty weak. You might need to take off a week or two. Make sure that you're rehabbing it. Make sure that you're following physical therapy. Make sure that you're stretching correctly to make sure that you don't progress the injury, right?
Right. So let's say, a high school kid or junior high kid gets a concussion from playing football. So we can do a CAT scan within minutes to find out, if they're okay, right?
Right. And of course, the concussion is a very tricky subject, right? Because it leads to, a lot of the kids are not going to want to talk about it, right? So that's why it's very important for us as parents and also the coaches to pay attention, because a kid might come off the field and he's confused and he doesn't want to stop playing. So you have to be really careful with that. Now, when you take these types of head injuries, you worry more than just a concussion, right? Because you can also have a brain bleed, or you can have a skull fracture, and it's painful. But remember, the kids could be confused. So they may not even know that they're in pain. They may not even know what's going on. So it's very important for us to pay really close attention and make sure that the trainers are evaluating your kids, make sure that the coaches are evaluating the kids. When you see a hit like that, especially a big hit, I mean, those are usually more headline news to the sidelines, right? But a lot of times people, linemen or running backs, you got to be very careful, but make sure that they, you continue to talk to them, make sure that they're, if they look like they're a little off and they're not paying attention, well, make sure it's not something, ask them questions, make sure you're talking to them.
Gotcha. And so with the CAT scan, are you able to see brain bleed if they have a bleed on the brain?
Exactly. And that's usually why we do the CAT scans, right? We make sure that there's no actual trauma associated with it, right? Make sure that the skull's not fractured. Concussions don't usually show up on CT. So you're looking for those other things. But at the same time, if it's an injury that would warrant a CT scan, you also have us talking to him, asking him questions, right? We're going to get more out of it than just asking, hey, how was your day today, right? There are very specific protocols and very specific questions that we can ask patients and see if they're slightly confused.
Right.
And
so
what's be a parent?
Right. What's the major red flags to look for in a concussion? I'm sure number one's confusion. What else would you say?
Well, sick to my stomach, nausea, vomiting, those are not great signs, right? I mean, and you got to remember, the person can take a hit and be okay. And then 30 minutes to an hour or 2 hours later after the game is where they start to have these kind of symptoms. And that's why it's very important, especially if the game's late, they come home and they go straight to bed. Make sure that you're talking to them, in the morning. Make sure that everything is okay.
So I've heard that when you get a concussion, I don't know if this is true. Is it true that one eye can dilate to a different size than the other?
Yeah, exactly. And that's why it's important to be evaluated whenever you get, whenever you think there's something going on, right? There's a lot of signs that, us as physicians that we look for. You can have pupil dilation, simple things though, some of the questions is what 7 + 7 + 7, right? And you try to ask them questions to remember. You tell them, we can check for short-term memory. Like I'm going to say dog, shoe, umbrella, and then you ask them another question and then you tell me to repeat those three things I told you. So you're checking for short-term memory, long-term memory. And if you're not used to doing it or you're reading it from, online, you kind of give them a little bit more time to think and you can miss those clinical pictures.
Right. Don't ask me too many math questions if I get a concussion. I don't know if I can do that on a normal day. No, I'm just joking.
And that's also the important thing, right? We also know that it's very age specific. So sometimes it's very difficult for you to evaluate kind of on your own, because if you're asking an 8-year-old, what's 9 times 7?
Yeah, that's going to throw them off. So let's say we know they have a concussion. What's the next step to get them cleared? How can they know that they're back to normal and they can get back in the game again?
This is very important. So whenever you have, for instance, athletes, right? You put them on concussion protocol. It's very important the first 24 to 48 hours to be very careful, right? I mean, that doesn't mean that you have to keep them out of school, but if there is some confusion, it probably is best to keep them out of school one day. The reason for that is, your brain is resetting, right? When you have a concussion, there's a lot of enzymes and neurons and chemicals that get released in the brain with the inflammation, right? So if you don't want to rush them back, even if it is just a regular school day, right? So if they're having symptoms, 1 day off is good. That way they kind of get their bearing, they get their balance, right? And that's just the initial thing, right? Because one of the most complicated things with concussions, if you clear somebody too soon, you run the risk of concussions becoming, easier to get, right? So if you return too soon and you're walking and your wife or your father opens the cabinet door and it hits you, it can put you again into a concussion. It doesn't take as much, right? Because the brain's kind of unsturdy. So it's always good. The one good thing about football in high school is they're pretty proactive, and I think a parent really needs to start talking to the trainer, making sure that they're actually, evaluating him outside of the hospital, right? It's a big team effort. What is the perfect timeline? It's kind of impossible to tell, and it's really more symptom oriented. If a child has nausea and vomiting immediately after, naturally that's going to consider more high risk, right? So you're going to be able to evaluate it in the emergency room, but also follow up, not just with the trainer. You want to see your primary care, and if he sees something, 5 to 6 or 7 days later, he may refer you to a concussion specialist, right? Like a neurologist. Unfortunately, the imaging component to say, oh, you have one or not have one, they're not perfect, right? Whether it's a CT, whether it's an MRI. And that's why it's about talking to the kids and making sure you don't rush it and make sure that you have professional.
Got to stay in tune with your children.
Right.
And I would rather, parents, you're watching, I would rather you bring your child in and it be nothing than not come in and have a brain bleed or worse.
Absolutely. There's nothing wrong with a clean bill of health.
Yeah, don't be embarrassed to bring your kid in. Make sure, they're okay. Get that clean bill of health, like he's saying. So I had somebody ask, what is hypertrophic cardiomyopathy? Did I say that right?
Hypertrophic cardiomyopathy.
I got it.
So,
all right.
that it's made a lot of headline news the last recent years because basically kids can just drop dead on the middle of the field. Okay.
Wow.
And what it is a part of the heart. So the ventricle, right, that normally pumps blood to the rest of the body. You can have for a variety of reasons. It's not necessarily a birth defect, but it's just something that during development, that part of the heart was bigger. And if you think of the heart, and this is not even just for kids, it's for adults. You're born with this perfect 4-bedroom house, right? And when you build a house, the electricity of the house, everything works perfectly, right?
Right, exactly.
And as you start to age, even a kid, if he's susceptible to the enlargement of this ventricle, that house basically you added a patio. So all parents listening, well that if you add something and then you put electricity, it's never as good as when the builder build a house, right?
Exactly.
And so what can happen with these individuals is that electricity can start to not kind of malfunction and then send the kid into what's called an arrhythmia, right? So something that is not normal heartbeats, and then therefore it can make the heart stop immediately, right? So it's very dangerous. And, we do physical exams. That's why kids need to get cleared, right? Because it can be associated with like a heart murmur. It could be associated with just getting winded, right? So that's why we ask questions like, hey, and of course you're not going to ask a kid, hey, after 10 miles, are you winded? But it's, does it take you a little bit? Does it stop you when you just start exercising? So those are like key questions that you have to ask. And how we diagnose it is through an ultrasound of the heart, right? And we look at all of the chambers of the heart and see if that size is bigger than it should be, because it's very dangerous. As a matter of fact, it's almost career ending for certain kids, right? You got to be very careful. Like, pro athletes, they get evaluated for it all the time because, you run a high risk, right, of sudden cardiac death.
Okay. So that's one of the reasons you also don't want to return too soon from a concussion, because you could have what you're talking about.
Right. I mean, they're usually not correlated, right? But they can. I mean, if you're weak, you're confused, you're not eating, and then you exercise too soon and you have that, then you're at a higher risk, right? Because it makes you susceptible to other things.
So speaking on, sports safety, hydration is such a big thing. It plays such a big part. And I know you always preach on this, hydration, hydration. And not just with sports, but a lot of people come in feeling horrible. And if they would, get hydrated, they feel great again. How important is drinking, on the field?
Yeah, it's very important. And we got to be careful with kids because they're never going to ask you for a water bottle, right? They want the Gatorade. They want all those other things. So you have to be careful because Gatorade itself, right? It's not really designed for you to just drink Gatorade, right? Either you mix it with water or, you have one, but you need 3 bottles of water associated with the Gatorade. Just because it has electrolytes, it doesn't mean that your body needs them, right? During the day, you actually are not as hydrated if you're someone who's not exercising and you're drinking Gatorade. It's actually worse for you because that can cause other problems, right? You can have too much salt. You can have too much electrolytes. So we want to make sure that we give our kids exactly what they need, right? And if they don't have a water bottle, they're not going to run to the water fountain station, right? And that's kind of the issue with a lot of times. I know for my kid, right, the football is not at the same school, so they have to travel to go somewhere. So it's not even a familiar environment initially. And these kids are playing, an hour to 2 hours after, an hour of possible recess for school. So the hydration is a big component because kids aren't drinking much water during the day. So they're getting dehydrated and then going out to the field, right? So it's important that we make sure that our kids have some sort of portable water bottles because they're going to be dehydrated no matter what. Even we are as adults, right? We're not drinking enough water. So if you add all that physical activity and then you don't give them something to be able to take with them, it's just a spiral, right? I mean, and it leads to a bunch of problems. It leads to constipation, right? Because if you don't have any water, then it'll take it from the bowel. It leads to headaches. It leads to dizziness, right? So all of those things are associated with not having enough water in it.
Maybe that's why I'm having headaches every day. I'm not drinking water.
That's the most common reason for headaches is dehydration.
I guess I drink too much Coca-Cola. So I need to start drinking some water. So that's great. Hydration's a huge factor. But I also know stretching is something you don't want to miss out on. So what's the right exercises you think with sports and age? Are they different?
Yeah, I mean, you don't want to rush kids into a weight room either. Okay, as long if it's well controlled, there's one thing. But having certain kids starting to do deadlifts and starting to do those things, they you really need to be careful. Kids need good direction. I mean, one thing is a 10-year-old that has good direction with their parents and they spend a lot of time. But when you have 60 kids in a room and you have 1 or 2 trainers, if they start picking up weights, they can really do some damage to their back. You have to be very careful. Stretching is something kids and adults, I mean, come on, us as adults, we probably don't stretch nearly as much as we should. Do you think our kids are? We stretch because our body hurts.
Yeah, we have no choice, okay?
Right, so, and it doesn't have to be super technical, but showing kids 4 or 5 different stretches. Make sure they stretch their hamstrings. Make sure they stretch their legs. Make sure they stretch their back, right? And their neck. It goes a long way because it also puts it into that they know that they have to do it. And once you start early, now for the rest of their life, they're going to spend 5 minutes stretching, right?
It's a good habit.
Why did I not do it? Yeah. No one told me to stretch. So now to add it, I'm like, well, this is a waste of time, So now I get up every morning and I'm stretching 5-6 minutes, or it's like hard to move.
Man, you get stiff. No, the other day I was in the garage, man. I decided to jump over this box I had put there because I needed to get to the other side, of course. And my knee, I felt like I ripped something in my knee. Seriously, just a small jump. I can't. I'm 35, right. I guess.
We're not 12 anymore, Reagan.
So it took me 2 or 3 weeks. Seriously, I don't know. I almost had to get an MRI. I thought maybe my ligament or something. I could barely bend my knee after that. I mean, so anyway, I'm back to normal now, but we can't do the things that we used to. Stretching, I got to start stretching more. So
right. No, it's something. It's something that it's very important. And you know what? It's also time with your kids. I know it sounds funny to be stretching with your kid, but it's fun. I mean, I did it with my 13-year-old the other day, and then my 2-year-old jumped on my back, and all of a sudden we started rolling around, and it's just kind of fun, to do any activity, especially with your kids, and it's something that's productive to the rest of their life, right? They start to learn exercises, and again, you don't have to, put a yoga thing on, right? I mean, right. It's great if you did, but It's just, simple stretches, teaching them little things goes a long way. And even goes a long way for you as a parent. You start to feel better.
Right, of course. So, hey, out of curiosity, I see a lot of people when they get, their injuries, I'll see the coach putting ice on their, where they strain their leg or arm. Does that help? Does that work?
Absolutely. Ice is, if you think about it, it's an anti-inflammatory, right? So the colder
Right.
it is, you decrease the inflammation. It's always, icing is great. Okay. Icing is very good, shown incredible studies the first 24 hours, after, right. Icing is always still good. My body doesn't do well with ice after 24 hours. Right. I don't like cold. So heat for me is better. So don't ever, there's nothing wrong with heat or cold, but it's always recommended the first 24 hours. So, if you have something, you have some swelling, you have an injury, go ahead and ice it. Right. I find peas are the best because ice doesn't really,
right. So does heat do anything different than ice does, or they both do the same goal?
So after the first 24 hours, the good thing about heat, what it's going to do is also increases the blood flow to the area, right? So if the muscle's trying to heal, the tendon's trying to heal, you're increasing the blood flow. So therefore you give more nutrients to the area to kind of help heal.
Right. So curious, when I thought I strained my knee, let's say you kind of strain your ligament, can it heal on its own, or do you always have to go get medical treatment?
So, there's a few things our body doesn't do, right? So, under the age of 18, you still have a lot of other hormones like growth hormone, your testosterone's a lot higher, and growth hormone can help heal a tendon, right? But as we get older, we stop making those, right? I mean, that's why a lot of men are on testosterone replacement after the age of 30. So a tendon, right? Usually it heals, but it doesn't heal with tendon as we get older, right?
Yeah. Right.
So if you think of this tendon, it's 3 inch by 1 inch, right? Every single time you're moving that knee, that knee that clicks, click, click, right? You're scraping off a little bit of that tendon. So what happens is the body has inflammatory markers, and then it goes to that area and it starts to eat away that little nick, right? The nick that's still sticking out. It eats it away. And then it comes in and it starts to heal it. But when it heals with scar tissue. And that's why our tendons are perfect rubber bands. And as we start aging and you have this chronic injury, it gets a little stiffer, right? So It's still 2 inch by 1 inch, but it's not a perfect rubber band. It's got some strength to it.
That's probably why it was stiff. The engine light is on. All the engine lights are starting to come on.
Exactly.
So Sarah said, at what age do you recommend kids start getting EKGs, with their yearly and sports physicals?
So, the EKG component is very important because it can actually show some of this, the hypertrophic cardiomyopathy, right? So there is some signs on the EKG, especially if it's a large heart, that we can see that on an EKG. Any child that's symptomatic, I recommend an EKG. Like that they get winded shorter, and it's like there's no reason for them to get winded. They have some chest pain associated with some exercise. I don't mean the typical cramp. I mean some actual chest pain, like they feel their heart kind of racing. I would always recommend an EKG. An EKG is non-invasive. It's very easy, right? It takes longer to set it up than to actually do. Right.
And you can do that at the ER, right? If they needed to come in
at the ER, right? And your primary care can do it. So I always, if a child at an initial, having kind of almost like a shortness of breath or chest pain, or anytime it just feels that they feel their heart racing, there's no reason why not to do an EKG. I mean, it's very safe, non-invasive.
Right. Exactly. Right.
Yeah. I mean, so the guideline for it, right? It's not specific for that you have to do an EKG on a yearly sports physical, but I think the more information you have from your child is never a bad thing, right? You get a sports physical,
sure.
If they have the EKG, I would say absolutely check
peace of mind. Yeah, for sure.
Yeah.
So let's say you do have an injury. I think I've heard people say at the ER you guys can give tramadol. Is that an inflammatory?
Toradol is through the IV. Tramadol is another one it's a pill. Right.
Okay. I'm thinking of Toradol. Yeah, I'm thinking of Toradol. That's what I've heard before.
And
okay.
And that's kind of the thing, right? So, if you think about it, you're worried about your kid. He, hit his head, or he's in pain, or he's having muscle cramps, he's having fatigue. One of the other beauties of coming to our ER, right, is we can evaluate him, and let's say, he's having leg cramps, right? We can check his electrolytes. We could, And at the same time, we can actually replenish the fluid, right? Take away the pain, give them an anti-inflammatory, and replenish the fluid all through the IV. And getting an IV bag, the reason why people feel so good, after, is you're putting all of that directly into the bloodstream, right? So it's not like drinking, a bottle of water, right? It's almost like drinking almost a gallon and a half of water, because all of that is being used immediately in the blood. You don't have to absorb it. You don't keep any. You don't really. You don't waste any of it. So it's like drinking almost a gallon and a half. So if someone does come in and they do have a headache, right? First, we clear them with a head CT if it's necessary, and then we can give them some medications, get that headache.
Gotcha.
And that leads to a lot of success, right? Because if you have a headache, you're not eating, you're not drinking, right? You just feel bad. You just want to sit in the room. So there's a lot of good things that can come from an ER visit.
Right. So you get the IV fluids. You said you could give Toradol, which would help the muscles, right?
Yeah,
I guess
and you want to make sure there's no reason why not to give it. Of course,
right.
Like if it's head trauma, you don't give it right away. You want to make sure that the there's no bleed or
right. So there's so many different options. I mean, you feel good with the fluids already, and then you can help with the inflammation, the pain. I mean,
exactly.
Total package.
And you speed up the recovery. If a kid comes in and he's fatigued and everything's off, and all of a sudden you give him an IV bag, well, he's going to sleep better, he's going to do better tomorrow, and he's going to be back on track. And also going through that, it tells him the importance of, hey, I want to do this again. I'm going to drink water.
and I know I say this every time. Every time I'm sick and I get fluids, IV fluids, I feel like $100. I don't know what it is. You feel good after you get a bag of IV fluids.
That's right.
So Obi said, what are your thoughts on contact sports? What do you think about those, Doc?
Everybody loves football, okay? But it is a strong, violent sport, okay? And we need to remember that children, if they're going to play any sport, specifically a contact sport, as parents, we need to be proactive. Then make sure they have good helmets, make sure that they have good cleats. If you don't set your child up for success, injury is more susceptible. You're not going to go out and play contact sports and they're wearing, bad sneakers and they don't tie their laces, right? You have to educate your kids on wearing the equipment correctly. My child hates tying his shoes, and I swear it drives me absolutely insane. He runs and his shoe falls off, and it's like, oh, but it takes me forever to do it. It's like, you're running without a shoe with people with cleats. You know what I mean? So I think contact sports is something that, it's part of our way of life. Okay. As long as you're proactive and you're careful and you don't rush them back in after an injury, for instance, a concussion, and making sure that you evaluate them, make sure they don't have little micro fractures, those things, it's part of the way of life. It's hard to tell somebody who's fascinated with football not to play football. Right. But, do I think that some kids start a little too early? Yes. I would say that, contact sports in some leagues are very early. I'm not really a fan of that, right? Because it can lead to injuries. And I don't think that the earlier years, they have the same setup as high school, right? Where they have trainers, where they have evaluators. So it's very reliant on people that are not professionals. I'm not saying parents aren't professionals, your child, but, you don't have that system, right? And, an 8-year-old kid they're so flexible. I wish I had that flexibility. So they may not tell you they're hurt, right? Because all they want to do is play. So I think parents need to really evaluate how early they put their kids in contact sports. Some kids are 10 years old and they're big kids and they can probably handle it, right? But everybody loves a Popeye, but I have a little olive oil as a 13-year-old. So I was not a fan of putting him into contact sports until he was a little bit older. He just finally got into contact sports at 13. Because he's so skinny.
Yeah, I love track. I love soccer. I played football a little bit, but I was so tiny, man. I'd get hit and no lie, my pants would fly off. But my boy, he plays soccer. He's really, skinny like I am. He's fast. So I haven't done football yet, but, I'll probably wait till later to do anything like that if we're going to do contact.
Right, you're about to hit your physical prime. I'm sure you'll get into contact sports soon enough.
I know, right? So we were talking earlier about, CT and MRI imaging versus X-ray. So I guess if they get hurt really bad, the best thing would be to do, of course, a CAT scan first if they're at the ER. but you could also write a prescription for an MRI, right, to get more detailed views.
Usually we do not. Okay, but what we're going to do is we're going to play quarterback for you, right? So when you come in and you have this injury, what we're going to do is we're going to say, there's no point going to your primary care, right? So we can call, for an example, bone and joint. Say, hey, I got this kid. He's got this injury, right? The exam looks, it's an acute injury. It looks like there might be some tears. We may want to look into this. And they follow up with them and they see them. Because remember, if I'm seeing you within the first couple hours, the pain could be much worse than it normally is, right? And so you want to give it time, right? They always want to give it time. The MRI imaging, unless it's, you saw the leg go one way, right? And it's going to break. There might be reasons to do an MRI immediately, but most of the time you got to be careful with an MRI, right? Because a CT cuts you in like 1,000 pieces, an MRI will cut you in like 1,000,000 pieces. So if you have this acute injury and you have a lot of inflammation, it doesn't necessarily give you a good image immediately, if that makes sense, right? So there's a lot of inflammation in the area, so it could kind of confuse the image.
See a lot of fluid maybe on the image.
Right. So what you want to do is you want to make sure that we're sending you to the right direction, right? Going to your primary care might be what you need, but essentially whenever you have an injury, I might say, hey, the best thing to do is follow up with an orthopedic, right? And that's how we determine it, because unfortunately, sometimes primary care is like, all right, well, you got injured today. And it's like, well, we can see you in 2 weeks. That doesn't help, right? You're hurt today, right?
That's the good benefit of coming to the ER, get that CAT scan.
Exactly. I think that's the biggest thing to remember. And we plan this is how we're going to do it. And we tell you and we tell the parents. And I think that's really important, right? Because the last thing you want to do is sit with a little fracture, right? That you may be able to move, but it's fractured, right? Or an ankle sprain. I have seen 13-year-old girls walking in, not that swollen, and and she's got multiple fractures in her ankle or even a tibia, in the tibia. Yeah. And then I've seen 20-year-old kids, unable to walk, swollen, and you do an X-ray and it's normal, right? So there's just no way to know. It's very difficult. Some of these.
The last thing you want to do is your kid's injured, but you don't know, and you keep, keep walking on it or making it worse.
There's nothing wrong with being safe. There's nothing wrong with being safe. And most of the time we're going to figure this out with an X-ray. So you don't have to worry about a lot of radiation. You don't have to worry about that. It's just a simple X-ray.
Yeah. So guys, if you're watching, you heard it. Dr. Goffy's going to do the legwork for you. You see that dad joke?
Right.
I got jokes all day, man. So anyway, Doc, I appreciate you talking to me today. Do you have any advice to the parents watching out there for their kids or anything you can think of?
Make sure you talk to your kids. Make sure you hydrate. Get them something. I show you this cup all the time, but this is probably not an ideal cup for a kid. Make sure it's something that can close. They can throw it in their backpack.
Bring them with them.
They can fill it up in different areas. Make sure that they're tying their shoes right. Make sure that you're talking to the trainers. Be very proactive. Okay, even if your kid doesn't play the whole game, they still do a lot of contact in practice, right? So make sure that you're talking to them. An injury doesn't always come at a game, all right, where you have that full staff. So make sure when they come home that you're talking to them. Make sure that you're on top of it. Make sure you ask them about the practice and make sure that you just get some information from them.
All right. Follow up. And Doc, tell them about our free medical screening. I mean, when you're there or the other doctors, they can talk to you. Free medical screening.
Exactly.
Any of our facilities. There's nothing to lose, guys.
There's nothing to lose by coming in and giving it a quick chat. And we're usually very fast in getting you in and out.
Yeah. So if you want that peace of mind, we're here 24/7, all locations, all emergencies, guys, not just sports injuries. We're here for you guys.
That's right.
Free medical screening, like Dr. Goffi. He's a star. I know that. I don't know when you're going to come into Lumberton or next, but you might have a line after your TV show. This
Friday and Sunday.
He'll be signing books, guys, signing autographs from his big CBS. So hey, if you're watching, just joining. Be sure to watch this weekend. I think it's October 3rd. They're going to play that hour piece
this Sunday.
All right, they just recorded it here at our Baytown location where I'm at, so I'm ready to see it, ready to check it out. So
I'm very excited. I mean, I'm a little scared because you don't know what edits or what they did. I called out Joe Rogan on some of the misinformation, so hopefully he doesn't want to kick my butt.
Hey, he may be getting on Twitter trying to find you, man.
Right.
I know to reply to you. So guys, check it out. This what channel was that? CBS, right?
CBS.
All right, CBS this weekend, October 3rd. Dr. Goffi, real deal. He's going to be on TV. So
you can watch it before football. It's all good. It's 8 a.m. So
that's right. All right, man. Hey, Doc, thanks for joining. We'll see you next time.
Pleasure to be here for everybody. You guys have a great day.
All right, man. Take care. So, guys, we try to do Doc Talk every other Wednesday. So it won't be next week. It'll be the next week. We'll post something on Facebook. So be sure to follow us. Be sure to like our page, our Altus pages, so you can be in the know. You can stay in, check out all of our shows that we do here, our informative things that we do. Hey, if there's anything you want to hear, any topic, guys, feel free to post it in the comments below what you want us to talk about. We'll discuss it. And let us know your suggestions. Just drop it in the comments below. We're so thankful you guys are joining, watching. We love our community. We're so thankful for you guys. And we're here, like we said, 24/7, all emergency guys. We're here for you guys. We're here for our community, all emergencies. And be sure to check out that free medical screening if you need it. Don't not come to the ER in an emergency, guys. We're here for you. There's nothing to lose. We have that free medical screening just to make sure you're okay, to give you that free peace of mind. So anyway, guys, thanks for joining this Doc Talk. We'll see you next time. Be sure, like I said, post the topics you guys want to hear. Hey, thanks, guys.